How many times have you felt exhausted, even without doing anything strenuous? Or noticed unusual swelling in your feet, a sudden shortness of breath, or a cough that just won't go away? For many people over 60, this sounds all too familiar. And the most common reaction is to think, it's just age, probably just tired. Maybe it's the heat, but what if these everyday signs are actually silent warnings of heart failure? Heart failure happens when the heart can't pump blood strongly enough to meet the body's needs. It affects millions of Americans every year, and older adults are among the most at risk. According to the American Heart Association, it's one of the leading causes of hospitalization in people over 60. And here's the scary part. Many only find out they have it when the disease is already in an advanced stage. That's because the early symptoms are subtle. They hide behind everyday discomforts and often go unnoticed. But ignoring these signs can cost you your health and even your life. In this video, we're revealing 11 silent and dangerous signs of heart failure. We're not starting with the obvious ones. We'll go from the least talked about to the most alarming, so you can spot your body's warnings before it's too late. Important. This content is for informational purposes only. It's not a substitute for medical advice. If you notice 2 or more of these symptoms frequently, seek professional guidance. Before we begin, leave a comment telling us which city you're watching from, and don't forget to subscribe to the Age with Strength channel. Here, you'll find simple, natural, and safe tips to boost your energy. Manage your blood pressure and enjoy the freedom to care for the ones you love. Get ready. Sign number 11 is the hardest to explain, but it might just be the most important. One of all, number 1. One of all, number 1. A constant feeling that something's not right with your body some days. Even without pain, fever, or clear symptoms, you just feel off. It's like your body is trying to tell you something, but without using words. Kind of feeling is more common than you'd think among people in the early stages of heart failure. Doctors call it a subjective symptom. It doesn't show up in tests, but when you feel it, you know it. Many describe it as a mix of restlessness, mild anxiety, low energy, or a vague sense that something's just not working right. And why does this happen? Because when the heart starts to lose strength, several systems in the body begin to shift at the same time. The brain gets less oxygen circulation, slows down, and the organs have to work harder to function. It's like a house where the power starts to flicker. The lights still come on, but they blink. Appliances run, but more slowly. Your body picks up on that, and it tries to warn you if you've been feeling off regularly, even when your test results are normal. Don't ignore it. It could be your heart's first silent cry for help. Number 10. Mental confusion or frequent memory lapses. You're talking to someone and suddenly forget what you were about to say. You walk into the kitchen and can't remember why. Or you start reading a simple sentence and lose focus halfway through. A lot of people think that's just normal with age, but when your mind starts slipping too often, it's a red flag. Mental confusion can be one of the first signs that your heart isn't sending enough blood to your brain. It might sound strange, but it actually makes perfect sense. The brain is one of the organs that uses the most oxygen, and it's the heart that delivers that oxygen. When the heart's pumping weakens, the brain is often the first to feel it. Memory slips, thinking slows down, concentration fades. Some people even report brief moments of disorientation, like they zoned out for a few seconds. It's like trying to watch TV with a weak signal. The picture is still there, but it glitches, freezes, and breaks up. That's what happens to the mind when blood flow isn't strong enough. So if you've been noticing frequent forgetfulness, confusion, or a foggy brain, don't ignore it. It might be more than just tiredness or distraction. It could be your heart, once again, trying to send a warning. Number 9. Dizziness. Feeling faint or blurry vision. Picture this. You're standing up, and suddenly you feel dizzy, like the ground shifted beneath your feet. Or you get out of bed and everything goes dark for a few seconds. Your vision blurs, your legs feel weak. You grab onto whatever's nearby. These moments are more dangerous than they seem, especially if they come with heart palpitations, weakness, or nausea. They happen because the brain, even for a few seconds, isn't getting enough blood. In other words, the heart is struggling to deliver oxygen to where it's needed. Normally, the body adjusts quickly when you change positions, but with heart failure, that adjustment doesn't work as well. The blood might not reach the brain fast enough, and you feel the drop. It's like the power in a house flickering every time you flip a switch. Sometimes it works, sometimes it shorts out, and that's risky. Besides the danger of falling, which can cause serious injuries in people over 60, this kind of dizziness is a clear sign your heart may be struggling to keep up. Many older adults brush it off, saying things like, "It was just a drop," in Prussia, or "I stood up too fast," but if it keeps happening, it needs to be looked into. If you've felt this more than once a week, especially when getting up or even while at rest, don't ignore it. Your body might be trying to prevent something more serious, if you listen in time. Number 8. Increased nighttime urination. Ever wondered why, as you get older, it feels like you have to get up to pee multiple times during the night? Once or twice might be normal. But when it becomes a pattern 3, 4 times or more each night, it's time to pay attention. This symptom has a name, nocturia, and one of its most overlooked causes is heart failure. During the day, while you're upright and active, blood and fluids tend to pool in your legs and feet, especially if circulation is already compromised. At night, when you lie down, gravity shifts. The excess fluid that built up during the day is redistributed and filtered by your kidneys. The result? Your bladder fills faster and you need to go. What seems like just aging or a prostate issue could actually be a sign of a weakened heart, allowing fluid to build up throughout the day. And here's another important point. Waking up multiple times at night directly affects your sleep quality, your energy the next day, and even your immune system. Over time, that constant fatigue puts even more strain on your heart. So it's not just an annoyance, it's a warning. If this is happening often, even without drinking much water before bed, pay attention. Your body is trying to balance something your heart can't manage on its own. And as we always say here, the sooner you understand the signal, the easier it is to change the course of your health. Number 7, loss of appetite, or feeling full. All the time, have you noticed that even after eating just a little, you feel like you've had a huge meal? Or that your appetite has simply vanished, like your body forgot what hunger feels like? This symptom is often underestimated, but it can be directly connected to how your heart is functioning in heart failure. As the heart weakens, blood starts to circulate more slowly and less efficiently. This leads to fluid buildup not just in the legs, but also in the abdominal area, especially around the liver and the digestive system. It's like the body starts to swell from the inside. The result? You feel bloated even if you've barely eaten. Your stomach has less room, digestion slows down, and your appetite disappears. Many older adults say things like, "I ate a piece of fruit and already felt full," or "I feel nauseous just thinking about food." The problem is that when you eat poorly, your body misses out on the nutrients your heart needs to stay strong. It becomes a dangerous cycle. Weak heart gives poor digestion, gives low energy, gives even weaker heart. This symptom can also come with mild nausea, a feeling of a blocked stomach, or frequent gas. So how do you tell if it's just indigestion or something more serious? Pay attention to how often it happens. If this is happening almost daily, even with light meals, and comes with fatigue or swelling, it's time to investigate. Remember, your body is speaking. If you're not feeling hungry, it might be because your heart is using up all its energy just to keep basic. Number 6, heart palpitations or irregular heartbeat. You know that strange feeling like your heart is skipping a beat or suddenly racing for no reason, like it's trying to get your attention? This is one of the clearest signs that something might be wrong with your heart health. Palpitations are abnormal sensations of your heartbeat. While they can happen during stress or physical exertion, if they show up while you're resting or start happening more often, they deserve serious attention. In heart failure, the heart becomes less efficient. To try and keep up, it speeds up like a worn-out engine, revving harder to stay running. And sometimes that rhythm becomes disorganized. You might feel like your heartbeat is out of sync, racing or even pausing for a moment, almost like the heart lost its rhythm. Many people describe it as a jolt, a sudden tightness, or a strange flutter in the chest. And the most concerning part is that these heart arrhythmias, when ignored, can progress into more serious conditions like atrial fibrillation or even sudden cardiac arrest. Here's an important warning. If you feel palpitations along with dizziness, shortness of breath, cold sweats, or weakness in your legs, seek medical attention immediately. And even if the palpitations come on their own, don't brush them off. Recurring palpitations don't just go away on their own. It's your heart trying to say, I'm overwhelmed, I'm struggling. Listen to that warning and take action in time. Number 5, sudden weight gain. With no clear reason you weigh yourself today, everything looks fine. But 2 or 3 days later, you've gained 2, 3, even 4 kilos without eating more or changing anything in your routine. It might seem like a small thing, but this is one of the clearest and most overlooked signs of heart failure. This kind of weight gain isn't about fat or food, it's fluid retention. When the heart begins to fail, it doesn't pump blood with enough force. This affects the kidneys, which start holding on to sodium and water. As a result, the body begins to store fluid in the tissues. What's tricky is that, at first, there may be no visible swelling. It's hidden weight, only showing up on the scale. It's like your body is being quietly filled from the inside. People notice tighter clothes, snug shoes, or even a watch feeling tighter on their wrist. Others don't notice anything until that fluid buildup leads to shortness of breath, abdominal discomfort, or pressure in the chest. Medical guidance is clear. Any weight gain of more than 1.5 to 2 kilograms in less than a week should be investigated urgently. It's not from overeating. It's not just part of getting older. It's a silent signal that your body is overwhelmed and your heart is struggling to keep things in balance. Number 4, persistent cough or chest. Wheezing, especially at night. Have you ever had a dry cough that just won't go away? Or noticed a wheezing sound in your chest, like you have phlegm, but without having a cold? A lot of people blame allergies, dry air, or even acid reflux. But when that cough happens, often gets worse at night, or appears when you lie down. It's time to pay closer attention. This kind of cough can be caused by fluid buildup in the lungs. One of the classic signs that the heart is no longer pumping blood efficiently. In heart failure, blood can start to back up into the lungs, increasing pressure in the pulmonary veins. The result, airflow becomes restricted, and you develop coughing, wheezing, and even a tight feeling in your chest. It's like your lungs are being slowly drowned a little more each day. And the interesting part is that this usually gets worse at night, exactly when you lie down. Lying flat makes it easier for fluid to pool, and the breathing discomfort intensifies. Many people say things like, I start coughing as soon as I lie down. I have to sleep almost sitting up. I have this cough that's not a cold and never goes away. If that sounds familiar, don't treat it as a minor annoyance. This is one of the most important signs that your heart is under pressure and already affecting your lungs. And the biggest mistake many make is reaching for cough syrup or throat lozenges, when what they really need is a heart checkup. Lingering cough is your lungs crying for help, but the one that's truly in distress is your heart. Number 3, shortness of breath when lying down or during the night. Picture this. You lie down to rest after a long day. But instead of relaxing, you feel like you can't breathe. Shallow breathing, chest tightness, or the kind of discomfort that forces you to sit up or even get out of bed and walk around the house. This is one of the most distressing experiences for people with heart failure, and a critical sign that the heart is under serious strain. This condition even has a name: orthopnea, difficulty breathing when lying down. And why does it happen? During the day, excess fluid in the body, caused by poor circulation, tends to pool in the legs and ankles. But when you lie down, that fluid shifts back toward the upper body, increasing pressure in the lungs and making it harder to breathe. In other words, the heart can't handle the extra volume, and the lungs feel the congestion. The result: a choking sensation, dry coughing during the night, or the need to sleep propped up with multiple pillows to keep your torso elevated. Many people describe it as, it feels like the air won't go in. I lie down and have to get back up. Just to breathe, I can only sleep half sitting. These stories are common and very serious. If you've been waking up in the middle of the night gasping for air or avoiding lying down because of shortness of breath, this could be a direct sign that your heart is failing at its most basic task, keeping oxygen flowing through your body. It's not insomnia, it's not anxiety. It's your body trying to protect you and warn you. The sooner it's investigated, the better the chances of managing and recovering. Shortness of breath at night is not normal. It never was. Number 2, swelling in the feet, ankles, or legs. Have you noticed your shoes feeling tighter at the end of the day? Or your socks leaving deep marks on your calves? Maybe your feet feel heavy, like they're filled with fluid. This kind of swelling, often seen as a normal part of aging, can actually be one of the clearest signs of heart failure. And here's why. When the heart can't pump blood with enough force, circulation slows down. Blood begins to pool in the extremities, especially the lower parts of the body, like the feet and ankles. That buildup increases pressure in the blood vessels, which eventually allows fluid to leak into the surrounding tissues. The result is swelling, or, in medical terms, peripheral edema. It's like your body is filling up a tank that can't drain properly. But here's the key. This swelling isn't like what happens after a bump or sprain. It's usually symmetrical, affects both feet at once, and tends to get worse at the end of the day. Often, it improves a bit in the morning, only to return as soon as you go about your day. And the longer this is ignored, the higher the risk. The fluid can move up into the legs, the abdominal area, and even reach the lungs, making it harder to breathe. Many people with heart failure say things like, "My usual shoes don't fit anymore. It feels like my legs are heavy, like I'm carrying extra weight." And the sad truth is, many of them just drink less water or start wearing compression socks without ever checking the real cause. Swelling might seem like a minor issue, but it's one of the body's most visible cries for help. If your feet are swelling every day, your heart may be struggling to keep blood moving the way it should. Number 1, extreme fatigue from simple tasks, washing the dishes, climbing a few stairs, getting dressed. Are these once-easy tasks now leaving you worn out, like your body just doesn't have the same strength anymore? This is the most common, most persistent, and most ignored sign of heart failure. When the heart can no longer pump blood effectively, the entire body feels it. Your muscles get less oxygen, your brain slows down, even digestion becomes sluggish, and that all adds up to a kind of tiredness that rest doesn't fix. It's not the usual fatigue after a long day. It's an overwhelming exhaustion that feels out of proportion to the effort. You wake up already feeling tired. You walk out to the backyard and need to sit down. You climb one flight of stairs and you're out of breath, with your heart racing. It's like trying to push a car with an empty tank. Your body wants to move, but it doesn't have the energy to keep going. And the most dangerous part is that this kind of fatigue builds up over time. You start avoiding the activities you once enjoyed. You stop going out, stop walking, stop caring for your home, until your life becomes centered around avoiding exhaustion. And that changes everything. It distances you from your family, your routine, and your joy for life. So here's a warning. If you feel like your body is failing at basic tasks, even though you sleep well and eat right, don't ignore it. It's not just aging. It could be your heart crying out for help before it gives out completely. Now that you've learned the 11 silent and dangerous signs of heart failure, it's time to look at yourself more carefully and take action. Let's recap. Extreme fatigue from simple tasks, swelling in the feet, ankles, or leg shortness of breath when lying down, or during the night persistent cough or chest wheezing, especially at night sudden. Weight gain with no clear reason, heart palpitations, or irregular heartbeat, loss of appetite or feeling full quickly frequent. Nighttime urination, dizziness, or feeling faint, mental confusion, or frequent forgetfulness constant. Sense that something's not right with your body if you've noticed 2 or more of these signs in your daily life. Please don't wait for things to get worse. Talk to your doctor, ask for tests, share what you've been feeling. The earlier the diagnosis, the better your chances of staying in control and living well. Ignoring these symptoms can be dangerous, but recognizing your body's messages and asking for help is an act of courage, self-respect, and love for the people around you. And now, I have a gift that could change the way you care for your body. Did you know there are natural, safe, and affordable ways to manage blood pressure, sleep better, improve digestion, and even support diabetes control? If you're looking for a more natural and effective path to better health, check out the Natural Healing Guide ebook. It brings together the best of natural medicine, with tips on teas, herbs, essential oils, functional foods, and practical solutions for your daily routine. Everything is explained simply, clearly, and with the care you deserve. The link is in the first pinned comment below this video. Take advantage of it. Your health will thank you. Here's the simple truth. Your body speaks, and most of the time, it whispers before it shouts. Those little signs that show up, the fatigue, the shortness of breath, the swelling, the mental fog, they're not random, they're signals. signals that something needs to change. And the good news is that change can start now. With more awareness, conscious decisions, medical guidance, and the support of natural medicine, self-care, and knowledge, you deserve to live well, with energy, clarity, and independence. And yes, that's possible, even after 60, 70, or 80 years of age. But it all starts with one step: listening to what your body is trying to say, and not putting it off. Now, tell me in the comments, which of these signs caught your attention today? Have you experienced any of them in the past few months? Your story might help others going through the same thing, and maybe they don't even know it yet. And of course, if this video helped you in any way, share it with someone you love. It could be the warning they need to make a real difference. I'll see you in the next video. And until then, take good care of yourself, because your health is your